This is day 2. This is exactly almost 24 hours after the surgery. Now it's time for my eye patch to go, and I will start with the drops. The doctors gave me 3 types of drops. One is a steroid, one is an antibiotic, and one is a low pressuring drop, just to probably regulate the eye pressure and prevent, it says glaucoma on the bottle, but I guess it's in relation to this surgery. So I'm gonna see now how the eye looks like, and the doctor promised to call me in this morning, or we're gonna have a phone chat. So I'm not gonna go back to the clinic, and unless there's a problem. But so far I had no pain for the last 24 hours. I see through. I don't have to actually open my eye to see the bubble, or it's like a small coin, black at the bottom. It doesn't really bother me, but it's kind of weird. But anyway, I was expecting that. So let's see how it goes. I will probably use this during nighttime, so I won't rub against the pillow or anything. The vision is a bit blurry. It's not that bad. There's some discharge right now, which I'm gonna wipe off, and I'll come and report to you later that I put my drops. Okay, this is the part 2 of the day 2. Still 8 o'clock, it's just 10 past 8. I already have a conversation with the doctor over the phone, and nothing new. I knew exactly what we were going to talk about, so no concerns at this point. The only thing I ask about the stitches, if they have any ability to scratch the inside of the eye and cause any infection, because that would be my biggest concern at this point. But no, the stitches apparently prevent infection, and just a little bit irritation. It's not that bad, it's just something that I didn't expect, but again, I think that's a minor thing in comparison in the whole picture. So my vision is not as bad. I thought it was going to be worse. It's a bit blurry, it's a bit hazy, but now I can actually see 3D, because with the eye patch with only one eye, you can try it yourself. You won't be able to judge distance, but now the fact that I have the second eye open eliminated that. So all good. I would, if I remember something to say, I might add a little bit more to it, but this is probably report day 2 apparently, and hopefully within the next 24 hours the eye will recover. I do have the little coin. It's quite black, and it's actually interesting. Still sits in the bottom of my vision. I know it's on the top of the vision because it's air, and it's up. So obviously the image is reversed, and that's an interesting thing to think about, because your brain, you see the world upside down, but your brain turns it back. In this case, because the bubble is inside the eye, it's before or after the world turns upside down, so it's perceived the other way. Anyway, I haven't thought that through, but yeah, not a biggie. So everything inside there is upside down. Okay, so hopefully everything will go according to the plan, and I will report to you tomorrow. And I will probably keep it to a week, 2 weeks, a month, 2 months, a year, 2 years, and maybe even more. So yeah, eye is a bit watery, but that was expected. I'll see you in the next stage, I guess. It's still the second day after the surgery. It's almost lunchtime. I'm preparing for the second round of drops into my eye. I have to say, very happy that my vision is almost like back to normal. Now, I've been told that my vision will be blurry for the next 3 days and probably it's gonna get back on track within a few weeks. But at this point in time, I have to say, yes, it's a bit blurry. I do feel a very minor scratch inside, and it's because of obviously the stitches. But right now I have no discomfort, no pain, which is amazing because I was expecting much worse. I've seen other YouTubers that said that they go through some pain and they needed some medication. No pain, no discomfort whatsoever, except the minor scratch. And yeah, it's I'm very optimistic at this point, and hopefully nothing will go wrong. And one of the stitches will go away on Tuesday as promised by the doctor, and things are looking very good right now. That's all I wanted to say. I actually saw the eye is not that bad. There's a lot of redness around it, but I can't see because I can't see close anyway, so I won't be able to actually look at myself unless someone films me, but I don't want to do that. Anyway, good things.